house and class. My name is Michael Patton. Today, my presentation is on a drug called Stelara. The generic name is ustekinumab, and I have a personal history with this medication because for years I have been affected by psoriasis. As you know, psoriasis is a chronic skin disease in which skin cells are regenerate a lot faster than normal skin cells. In other words, skin cells on a person with psoriasis generates anywhere between 3 to 5 days, whereas on a normal person without psoriasis, the skin cells would generate anywhere between 28 and 30 days. And I want to call your attention to my slides. Give you a little history about psoriasis. Psoriasis is a chronic autoimmune disease that appears on the skin. In other words, your autoimmune or your immune system operates at a faster rate or a hyper rate than normal immune system. This causes the rapid formation of skin cells in the least amount of time. The most common form of psoriasis is plaque psoriasis, something that I've suffered from for many years. And they appear as raised red patches covered with silvery white buildup of dead skin cells. And sometimes the area is just red. It may not be scaly, but it may be red. Over 7 million Americans are affected with psoriasis. It's more predominant in the Caucasian community, but a lot of minorities do suffer from this disease. What is Stelara? Some of the treatments that we have for psoriasis are topics like clobetasol and Dovanex. And those are some of the things that I tried. However, after a certain period of time, those treatments stopped working. And so my dermatologist recommended Stelara. Now, Stelara is a prescription biologic immunosuppressant medication, which means that it slows down your immune system. And it's used to treat moderate and severe plaque psoriasis in adult age 18 years or older. However, Stelara is not the first biological medication that was used to treat psoriasis. You had medications like Enbrel and Humira, which I also tried, but they did not work as well as Stelara. Next slide, please. The dosage and administration. Stelara is administered by a subcutaneous injection. Patients weighing less than or equal to 220 pounds, the recommended dose is 45 milligrams initially. And 4 weeks later, followed by 45 milligrams every 12 weeks. In other words, your initial injection, you would get one initial injection, then 4 weeks later you would take another injection, and then after that, your treatments are every 3 months or 12 weeks. Patients weighing more than 220 pounds, the recommended dose is 90 milligrams initially, and 4 weeks later, followed by 90 milligrams every 12 weeks. The half-life of this medication ranges anywhere between 14.9 to 80.2 days. Also, the absorption rate, it takes about 7 days. Next slide, please. Some of the benefits of Stelara is there are relatively few side effects because while being a highly effective form of treatment. And that can be attested to the amount of time in between injections. It's administered every 3 months instead of weekly or bi-weekly injections as with other biological treatments such as Enbrel and Humira, respectively. These are, as I said before, these are some of the treatments that I've tried before, and they work for a short period of time, but after a while they stop working. But they're primarily used in treating psoriatic arthritis. Now, Enbrel and Humira, you have to take them either weekly or bi-weekly. And it can be kind of a hassle a little bit, but as long as the treatment is, as long as you're able to get treatment and relief from any symptoms, it's not a problem at all. Next slide. The risk and side effects for Stelara is that it is immunodepressant medication which may make your body vulnerable to infections. One of the warnings that your healthcare provider will tell you whenever you take Stelara is, or any of the biological immunosuppressant medications, is that they will suppress your immune system. They won't totally shut your immune system down, but it does open up your immune system to infections. And some of the infections that it may open you up to are cancer, tuberculosis, rashes, and upper respiratory infections. Before you take Stelara, you have to have or have to get a tuberculosis test to ensure that you can take this medication. Next slide. Other risks and side effects are, if in the elderly, the caution for the use of Stelara in the elderly is highly advisable due to the increased infection rate within this group. In other words, the elderly, as you get older, your immune system starts to weaken. And whenever someone of a later age has psoriasis, these type of medications are not really advisable because their immune systems are already weakened. And they don't want to, the healthcare provider doesn't want to weaken that immune system even more. Also, there's not enough data on the effects of Stelara on expectant mothers. So expectant mothers or expectant women should talk to their healthcare provider before any treatment. And the reason being is because the medication can come through, especially if they're breastfeeding, can come through the breast milk and can affect the child. So there's still a lot of research being done on the effects on expectant mothers or women that have already had children. Next. So I want to take a look, give you all a little opportunity to take the quiz that I have for you. How many Americans are affected with psoriasis? What is the recommended Stelara dosage for patients weighing 268 pounds? What are some of the risks associated with the use of Stelara? What are some of the benefits of Stelara? How is Stelara administered? I want to thank you for taking the time to listen to my presentation. That concludes the information that I have on Stelara. You can also research this information on the website, especially within the Federal Drug Administration website. Thank you for your time. Good afternoon and have a great day.